in 1945, the nation as a whole, by a large majority, decided that we were, as Nye Bevan said, we were going to do the most civilized thing in the world. That was to make the care of sick people a burden on everybody instead of just on those people themselves, and that it was the duty in families of healthy people is to look after those of them that are sick. Well, why is that not true of a whole nation?
In 2012, the Health and Social Care Act was passed. It marked the endgame in a 25-year plan engineered by Conservative and Labour governments to end the right of healthcare for all and push us into an American-style healthcare system. This is a film about how the NHS is being abolished, what this means for you, and what you can do about it.
This is the Abolishing Act. 457 pages of it, of legal, technical detail. Fundamentally, the Act removes the 60-year duty on the Secretary of State to secure and provide healthcare for all citizens throughout England. It only took 2 pages to remove the duty. The other 456 pages, 55 pages, are dedicated to a new market bureaucracy, bringing in insurance structures modelled along the US lines.
On March 7th, after 2 years of struggle, campaigners met in a last-ditch attempt to persuade MPs to vote against the bill.
We believe the government have been trying to hide the real issues in the bill. We call it the NHS privatisation bill because the tenure of the bill is all leading to different parts of the health service being privatised in different ways.
As a carer, I'm very concerned about the NHS, like it'll end up down the privatisation route, and what's going to happen to young disabled people.
If you've got somebody in cardiac arrest that you have to take to Scarborough, York, it's a half an hour run at the very least. So yes, people are going to die. It's as simple as that.
Barnsley supposedly have had 4 years to write up this bill, and if he's written it up for 4 years, he's made that many mistakes. I mean, it was flawed from day one. Anybody who read the 300 odd pages, wasn't it, which I did, because I was the National Minister for Health at the time, it was flawed from day one, and it could never have worked. So I don't know who's written that bill, but he had it ready within weeks of getting into power.
The risk register, I think in a democracy, to keep such an important issue to everybody, to keep everything they know about, everything they plan for away from the public, is a tragedy. It shows you that our democracy isn't actually functioning as well as it should be. We're naive enough to think that we're any different to America. If we privatise our healthcare, we're going to have a system like they have in America. But they have a lower life expectancy than parts of Cuba. They have a higher infant mortality rate than Cuba, which is a third world country. Socialised medicine in a third world country works very, very well.
I mean, we're both professionals, not in the job that we do now, but we were in the NHS. And you have to stand up and be counted, because that's what you're there for. Your duty of care is to the general public.
It's completely immoral to make profit out of people's illness. That's the main reason that I'm against the bill, because this is privatisation by the back door. So I think they know, they've buried this, they know that there is real risk of harm to patients.
I look at doctors and nurses, they're special people to me, and to see them being sacked or made redundant, whatever they call it, it is a sad day when you see things like this going down.
And their failure to publish most of the risk information shows that they're trying to cover this up. I think the fact that you've got doctors assembling outside the British Medical Association and marching here today, which is something that never ever happened even under Margaret Thatcher, something pretty big is happening. Most worryingly, when we talk to people about it, the most overwhelming thing has been confusion. People have heard something about it in the media, they've got no idea what it means or what the implications are. Yet when we start to talk to them about actually this could mean the whole of the NHS could be like the current NHS dentist system, they're completely horrified and they feel kept in the dark, and that's the most worrying thing. By the time people realise what the implications of this bill are, it's going to be far too late. They're going to be on the receiving end of it and they're going to be shafted.
On the 20th of March 2012, MPs voted the Health and Social Care Bill into Act. 147 lords and 73 MPs had financial interests in private healthcare companies and stood to benefit financially from the bill's passing.
I don't know how many of you know, but the NHS in England has now been abolished, and as of April next year there will be no NHS.
So what was the Health and Social Care Act really about? The most important thing to know is that the Act ended the Secretary of State's legally binding duty to provide healthcare for the English people. As a result, there is a long list of essential services that you are now no longer legally entitled to. A system devoted to providing us with an effective healthcare is being replaced with this: a system devoted to private profit hiding behind the NHS logo. It won't cover you. It will cost twice as much. And you are paying for it.
Democracy, as I'm sure the classical scholars amongst you know, its root is rule by the people. And when the voice of the people is distorted and ignored, we need to consider how to hold our representatives to account. But extraordinary times demand extraordinary measures. We need organised protests, occupations, a refusal to cooperate with the legislation from the people who can do that. For example, a boycott of the private sector. We need to use social media to reach the public. And we need to support the new National Health Action Party. We're not afraid to take on that responsibility. That's why we're here today. And the fight to reclaim our NHS is on. It begins here, and I know you will all be part of it. Thank you.
One of the most shocking things of all was the failure of the media, especially the BBC, to report the real truth about what was happening. But the real message about the destruction and the dismantlement of the NHS was never explained to the public. The BBC never took the time to understand what was happening. And I think that's one of the most shocking things of all, was the role that the BBC played in being an agent of the government rather than an agent of the people and for the people.
Whose NHS? Our NHS. Whose hospitals? Our hospitals. I would like to invite specifically any member from the steering committee of the Save Lewisham Hospital campaign to speak on the mic if they would like to do so.
We were very successful in our court actions to defend our A&E and our maternity services at the hospital, and now we're looking to make sure that privatisation doesn't lead to the end of the NHS as we know it. We want the service to be publicly funded and for NHS services to be the ones that people will use.
Care is a right for everybody, and we're very angry at the growing privatisation which is being done behind people's backs. The government has not been clean about it. They're putting it all through the back door.
Imagine when we switch on question time tonight, no mention will actually be made of the fact that there's been a protest here tonight. And even when earlier this year over 30,000 people marched through the streets of Lewisham to save the local hospital, there was very, very little media coverage around that. And to be honest, it's fairly obvious, and it's sadly obvious that, you know, when you've got a news company that works, that is part of the state, it's going to work for the state, unfortunately.
Your taxes at present will fund the doctors, will fund the nurses, and obviously for patients. If it's privatised, a large section of that money will go in profits to private companies. That's a very bad thing, because there's only three ways they can make money. They can cut staff terms and conditions, they can cut the level of service, and of course they can actually cut the amount of service that they provide. And then we talk about building the greatest, biggest democratic movement since the poll tax, so that we can defeat the Tories and save the National Health Service.
Government has consistently denied that they're privatising the NHS, and actually the World Health Organization definition of healthcare privatisation involves private companies delivering care publicly funded. That's still privatisation.
Hey,
we've got rid of the NHS. We've been wanting for it for decades. We've done it. Thanks, Cleggy. Really proud of you, Cleggy. Couldn't have done it without you. Well done, money.
No, NHS. Why are you so condescending? And you're forking under this government ring fencing it so NHS increase. NHS funding will increase every year.
Democratic mandate to privatise our healthcare system.
This legislation is a bottle of snake oil. It doesn't do anything, it says on the label.
As a response to NHS privatisation, Doctors Clive Piddell and Richard Taylor founded the National Health Action Party.
Let's not give up hope. The most important thing is to have hope. Because at the moment it doesn't look good for the NHS, but if we stop the privatisation now, we can help the future generations for years to come.
We do need these sorts of campaigns all around the country. There's a very rapid acceleration of plans that have been put in place. They've been put in place over the last 20, 30 years.
Shame on you, David.
On the NHS's 65th birthday, Dr Clive Piddell and colleague David Wilson begin a 65-mile protest run from the Department of Health in London to David Cameron's constituency in Witney.
5, 4, 3, 2, 1. See you in Witney.
Clive and David have run 40 miles. Both runners are exhausted.
You feeling rough, David?
My uncle, who was an American resident, he'd worked in Hollywood, he had the Rolls-Royce of private medical health insurance. He was in a private hospital. That was time limited though, because his insurance, you don't always just get open-ended treatment. So when he's also sold his house, and when that ran out, they just took all his tubes out, lifted him like a little skeleton into a wheelchair and put him on the pavement. He had to be taken home in the back of the gardener's truck because, very nice gardener, very kind of him to offer that, because they couldn't possibly afford the ambulance. So my uncle died the next day. And the day after that, because no time is wasted, my aunt and my cousin were presented with a bill for $2,500. So it doesn't matter what you're going through and how bereaved you are. Now, I'd love to say, I would really love to be able to say that this is a shock horror story, but it isn't. It's normal, it's ordinary, it's common, it's just what happens in that health service. Normal.
We know the disaster that it causes in America. 60% of bankruptcies in America are caused through healthcare.
So the real threats that are coming down from having the best service, the most value for money service in the world, to moving over to a system like the American system, which is a failing health system.
Since the privatisation project began in 1990, the NHS admin costs have risen from 6% to 14% of the NHS budget, wasting billions. In the American system, 36% is spent on bureaucracy, with only 64% for patient care. As a result, healthcare takes up 17% of America's gross domestic product, compared with the 9% in Britain.
Compared to every single other healthcare system in the industrialised world, the American one is pretty much twice as expensive as anywhere else, more than twice as expensive than in some places, with worse outcomes, and this government is essentially trying to replicate that situation.
Yet, only 61% of people are covered by the American system. That leaves 39% with no cover at all, including children. In America, 60% of all bankruptcies are due to healthcare bills. 75% of those had healthcare insurance.
I had to go into hospital and they put me in hospital. In the United States, your medical insurance is through your employer. So if you don't work, you don't have any medical insurance. Well, unbeknownst to me, or any of the other workforce, our managers for the company had actually cancelled the insurance policy. So while I was in the hospital bed, about an hour or so later, I got a phone call from the finance department saying that the insurance had been cancelled from my employer and that if I didn't have $300 to pay them then and there, I had to leave. So I had to cough up $300 to have my, to be taken care of.
Maybe 6% of our GDP for a decent healthcare system, or paying about 20%, which is what people are paying in America.
A public service like the NHS has been dismantled enough. That's when the actual prices of private procedures will suddenly rocket.
I think that what people don't realise here about private insurance is that what we have here now, yes, it is helpful if you have to avoid a waiting list, that's true. But it's only really available for acute care. It's not available for ongoing long-term conditions. So if that kind of care goes by the wayside with the NHS, then even if you have private health care, it won't help. The other thing is that it's somewhat being addressed by the health care that Obama passed, but insurance companies have typically not covered people with pre-existing conditions. So again, if that kind of coverage disappeared from the NHS, private healthcare wouldn't help. The other thing that people don't realize is that private healthcare in this country right now is relatively affordable. And that's because it's not essential. The minute it becomes essential, I'm sure it will go up.
If people think that having private healthcare insurance is a way out, it's not. You'll find that your entitlements and your benefits are severely limited, especially as you get older, because private insurance companies are risk averse. They need to be able to select out their clientele on the basis of their risk, and they also need to be able to deny people care.
Hello. I was looking for the casualty department.
Do you mean Langsley Frontline Services PLC?
Do I?
Are you on our customer list, Mr.
Hapless. Jonathan Hapless.
Mr. Hapless? Fingerprint, please. No, see, you're not registered with us. Actually, you're not covered by any CCG.
CCG?
Clinical Commissioning Group. You need to be on a CCG list if you want to take advantage of a National Health Service customer treatment package.
Okay, look, I'm pretty sure I've broken my arm, and I just want to see a doctor before I pass out from the pain.
I understand, Mr. Hapless, and I'm going to do everything I can to assist you in facilitating a solution to your problem. Let me just check your records. Oh dear.
What?
Are you a smoker, Jonathan?
No, not anymore. I used to be, years ago.
Yes, that is a pre-existing condition, and I'm afraid it does limit your options considerably. Best I can do for you is sign you up to our Emergency Plus package. That entitles you to up to 4 primary healthcare procedures in a 12-month period, excluding any of these.
Does it cover broken bones?
There is a surcharge for compound fractures.
OK, fine. Let's just do that. But this is still the National Health Service, right? Because I didn't vote for this.
Nobody voted for it, Jonathan. Now, how will you be paying?
I first actually found out about the Health and Social Care Bill by going to a meeting which explained to local residents exactly what this new law, if it became law, would mean. And I don't think I've ever been so shocked. I mean, really, genuinely, completely amazed, disbelief, and how serious and important it was. And then when they announced that they were thinking of closing Lewisham Hospital, it was literally as though the touch paper was lit, and all of a sudden many people from every walk of life came together. Every political persuasion, every faith, every kind of person seemed to become part of the Save Lewisham Hospital campaign.
The Secretary of State's decision to close Lewisham was driven by the need to solve the financial problems in a neighbouring trust, heavily indebted to private financiers through PFI, the Private Finance Initiative. The decision put financiers' profits before the people of Lewisham.
The government want to keep the PFI hospitals open because they want to make sure that their friends in the city get their income. But that means the neighbouring hospitals, they want those to lose patients and the patients to come into the PFI hospitals. And this is what we've seen in Lewisham. You've got a perfectly functioning hospital in Lewisham, and in a neighbouring trust, a completely separate trust, you've got a failing PFI hospital that's leaking money all over the place. And in order to keep that viable, they want to close services in Lewisham.
The accident and emergency unit and children's wards were marked for closure. The maternity unit was to be downgraded.
The thing which became clear to us very early on was that we weren't being listened to. It was almost medieval. This was people at the centre in Whitehall seeing that there's some problem out there, and we'll send one of our own out to sort it out, and they'll just have to do as they're told.
So what provision has been made by the Secretary of State to deal with that and to plan for those children?
So he's given us a decision and sort of said, sort it out.
So there is no plan?
There is no plan. Children were assumed as, the term I've used, as collateral damage of the major decision to close the hospital.
So what was the consultation about children and their needs?
Whole chunks of services were just not addressed, like the paediatric care at the hospital wasn't really even addressed in the consultation, so it wasn't, nothing was done thoroughly and properly.
Children don't matter.
Apparently not.
There wasn't a single piece of data about children, and they'd been forgotten. So we raised this vigorously and said, I think you've forgotten 20% of the community.
If you could hold your thought, how many children are we talking about?
In Lewisham, there are 63,000 children under 19. And across the 6 boroughs, over 300,000.
They haven't really understood the legislation that they themselves have written, where they've actually been found to have made decisions regarding Lewisham that have been unlawful, and which is pretty astounding, really.
The fact that we've had to take the Secretary of State to court, and then the judge says, Secretary of State, you do realise you didn't even have the power to do what you tried to do. If that's not contempt for local people, then I don't know what is.
I find it quite astounding that they were in court and actually their legal team at one point weren't able to answer the judge's questions. So they were told to go away, think about it and come back like, naughty children.
There is a need to ensure that the public at large, well beyond the boundaries of Lewisham, recognise what is going on. It's going on in all the welfare services, of course, but what is going on to their national health. And we don't want them suddenly to wake up, which they at the moment may do if they're not careful, to find that what they depended on since 1948 has disappeared. A very substantial proportion of those deciding this in our so-called democratic organs are part of the very vested interest that is going to profit from what is going on. So it's pretty clear that this is profit before people, no question. Yes, treachery even. And if there were a criminal offence that could be attached to that, I'd be in the forefront of trying to prosecute it.
The community of Lewisham took the Secretary of State to court and won.
Though we celebrate this victory today, there are clouds on the horizon. Threats to the hospital are, for example, the government announced in the summer that there are plans to close 9 London hospitals, and interestingly, Lewisham was listed in that list of hospitals. So the fight for our hospital must recognise these wider issues and link in with other campaigns around the country to defend our NHS, seeing this victory as just round 1 in further battles to come.
I think all staff should be part of their union, and all the unions in the NHS need to work together to make sure that they can never shut this hospital, and to be part of a wider NHS campaign to make sure that we keep this NHS for everybody.
On the 5th of November, there's a National Day of Disobedience, civil disobedience. We are going to protest about what's happening to the NHS, what the bankers have done. The booths and shops who have not paid their taxes in this country, the loan sharks that are killing people.
Stand up, they're not closing us down. Come on, ain't gonna shut us down. Stand up, they're not closing us down.
Save our fire stations, save our hospitals. We will have protests across the country. We need to have more civil disobedience.
No shit, ain't gonna shut us down.
Save the NHS is what we're going to do. What we gonna do? What we gonna do? I can't hear you. Can't hear you.
The demonstration this morning was specifically to prevent Clause 119, which is basically the Conservative government's attempt to reverse a court decision that protected Lewisham Hospital. And this is a story that we see played out time and time again. One of the speeches today was about how a hospital in Staffordshire, Newark I think it is, the mortality rates for their A&E have gone up 47% since the cuts started. So 47% more people have died because of the cuts. These are homicidal policies. These are policies that are shown already to be killing people.
If this clause goes through, then other hospitals that are working, solvent, meeting clinical needs will all be threatened.
After 90 minutes rest, the runners prepare for the next leg of the journey.
Still well on schedule. County councils have got plenty of money, I think. Tory councils, you see. Aches and pains? Yeah, hurts. Achy. Legs. thighs.
The scream to restart.
Yeah, it's achy. It's not good to restart running again. So, but we'll get there.
How many miles more to go?
I think it's about 20 odd still, I think just under a marathon left, I think.
Clive is standing against David Cameron in the next election as a National Health Action Party candidate, where he plans to unseat the Prime Minister who betrayed the people. The next stop is Oxford, where they will try to raise awareness about the danger posed by Andrew Lansley's privatisation bill. The doctors have 6 hours to reach Whitney.
So we're hoping the public are eventually going to get the message, but it might take a while. Unfortunately, it'll probably be too late before they get that message, but we're doing our best to try and raise public awareness that our healthcare system's being privatised. We'll see increasing privatisation, money taken away from local hospitals, going to the private sector, off to offshore tax havens, and the public are going to suffer. And we're trying to do our best to try and prevent that and reverse it.
Now, the one thing that stopped the government from being able to move to full privatisation and full closure of the NHS was the duty on the Minister of the Secretary of State to secure and provide universal healthcare for all. But the government is fixated on pleasing the private for-profit sector, the big international corporations. So the one obstacle that was there, it had to remove, which is why the Health and Social Care Act was so important, because it took away the duty on the Secretary of State to secure and provide healthcare for all. And once that duty was removed, the government could then move health for leather to the marketplace and launch a full privatisation programme. And that's what's actually happening.
There was an incident here last year in Stafford where a man had a heart attack, literally about half a mile from here. But it was just after 10 o'clock. They called an ambulance, the ambulance didn't arrive for 21 minutes. It was a further 23 minutes before he arrived at Stoke-on-Trent, where he was dead on arrival.
In another case of profit before people, services at Stafford Hospital were threatened with closure. Local people occupied the hospital site in protest.
Unfortunately, I think most people will only become aware once they actually feel it at the point of need. Their wife suddenly has difficulties in pregnancy, and her life could be in jeopardy because there's no consultant-led maternity department in.
We'll all be living in Shit Street when paediatrics is gone.
We'll all be living in Shit Street, and it won't be very long. We'll all be living in Shit Street when A&E is gone.
They're in it for the money, and God knows that's wrong. We'll all be living in Shit Street when A&E is gone. You going to let them destroy it, or fight for it to carry on? We'll all be living in Shit Street when the NHS is gone.
This is a genuine life or death situation. Once they close those services, people's lives will be at risk. I, for one, won't be able to look into the mirror if I don't think I've done everything possible to avert that from happening. So.
This little piggy went to Wolverhampton. This little piggy didn't care. This little piggy went to North Staffs, but sadly didn't make it there.
Wake up all your neighbours, tell them of the plight, let them know what's going on and why we have to fight. Let Mr. Complacent at number 84 realise when he is ill, his health's at risk. What's more, the march of 50,000 opened all our eyes. We grew in solidarity, we showed our strength and size. There's another opportunity to march and let them know. Staffordians, please congregate and let your passion show. We will not be manipulated, we'll damn well have our say. We're meeting at the Stafford camp and Tuesday is the day. We're marching to the CCG, we will not take this strife. Each unborn child and babe in arms is a valued, precious life.
After 20 hours, Clive Piddell and David Wilson have completed the 65 miles and arrive at David Cameron's constituency office to bury the NHS coffin and bring Clive's warning to the people of Witney.
The people of Witney, you should not vote this man back into power. If you vote Cameron back into power, you will not have an NHS for years to come, and it will be impossible to get it back. So I'd like to say to the people of Witney, do not vote for that man, because you won't have a national health service if that happens. We've got a chance to reverse the changes, and that won't happen otherwise.
That's it, perfect, Dad.
Well done, David. Well done, Dave.
GPs were conned.
Yes.
And they thought it was going to be quite lucrative. But when they've actually got around the table, many of them now are sort of changing their minds and going back to practicing. But it's crazy, really.
Healthcare professionals and citizens walked the 300-mile route from Jarrow to London to try to raise awareness and make people understand that only if we fight will we protect our children's future.
My mother lived in Canada for a year, and what happened was that she knew a couple and she went to the hospital. The wife had a baby. She went to the hospital with the husband to see the wife and the baby. He didn't actually have enough money to pay the hospital bill, so they actually kept the baby in hospital until the husband had enough money to pay the bill. And that's obviously, something that wouldn't happen here. And to my mum, morally and ethically, she felt that was absolutely horrendous.
They wouldn't release the baby?
No.
It's outrageous.
And the bill kept going up because obviously they kept the baby and they were looking after the baby.
It's like keeping a car in a storage.
Yeah.
You have to pay so much each day it's in there.
Yeah.
Mr. Cameron, if you ever get hold of this and you keep saying that you are caring, you are no more caring, Mr. Cameron, than a school of piranhas, picking the bones of the sick, the poor, and the disabled, until there is nothing left for them to take but these shell. So don't you dare say that you are a caring government, because you are not. The National Health is the greatest thing that this country ever gave to the British people. And you are not going to take it away, because if I have to, I will fight you to the death.
My NHS! Our NHS!
I've been a campaigner all my life, and I'm good, and I know where to press the buttons. And I'm going to fight with everything I've got. Everything.
I thought I didn't want to come and just speak and go. I'll march before I say anything. That's the.
Did you know that I wrote a poem for them?
Yeah.
Did you know that?
No, I've not. Have you got it? Can I read it?
I'll give it to you.
Go on then. Yeah.
Bless them all, the long, the short and the tall. Bless all the nurses and their starchy frills. Bless all our doctors and their stinking pills. For we're saying goodbye to them all, as down to the OT we crawl.
Yeah.
We'll throw all their portions right into the ocean. So cheer up, my lads, bless them all.
Nice.
Are
Oh,
they
brilliant.
going now, then?
I can't believe you've come all, you've done it all the way.
I make.
When Labour get in and
and they don't deliver on their promises, what will happen then?
I've got Dr. Mahendran, he's brilliant. He saved my life 4 times.
Right, yeah.
And our surgery
that's
is
proper commitment.
breaking at the seams because of all the cuts.
Right, are we heading off? I mean, what will the people do? What will be the resistance to the continued privatisation, which will happen under Labour regardless? What will we do?
No ifs, no buts. No NHS cut. Whose NHS? Your NHS. Whose NHS? My NHS. Whose NHS? Our NHS.
I've just been watching this march go by, and I was really impressed at how it looked and how it sounded. So much force, and it was very dynamic, and the colours and everything. It was like, wow, people are putting so much into this march, it's beautiful. And everybody is agreeing, everybody's joining in, everybody's into the message. We need to get our message out to them. It's the most important thing. You've got to, make it, put that much energy into it as they put into theirs. That's how it's going to work. Because, we can do this. We can change things, and we can get things to become the way, we want them to be if we all put our feet first. We've got to vote with our feet. Action.
But this isn't just local dispute, this is a national fight. We're dealing with a government nationally that's out to wreck the NHS, and it needs a national response, and that's why this march is so important.
Whose NHS? Your NHS. Whose NHS? My NHS. Whose NHS? Our NHS.
And I want to say to you all, I know I've got a huge responsibility to all of you, as the representative of the party that created it, now to stand up for it and to ensure that we have an NHS that puts people before profit. That is what it was set up to do. That is what it must always do.
And I told Cameron that he's always telling us how caring he is.
Yeah.
So I told him that you're no more caring than a school of piranhas thinking the birds of the
How was
sea.
that?
This gentleman did it.
David Cameron recently quoted Tony Blair. Sorry about those two names in one sentence. Yeah, boo, come on. David Cameron recently quoted Tony Blair's advice. Isn't that nice, Tony Blair's advising David Cameron now? On NHS reforms. That advice was to see the reform through, because after the NHS bill passed, opposition would die away, and it would be as if it was ever thus. Just think about that. So, I'm going to leave you, Mr. Cameron, and everybody here, with the words of Mahatma Gandhi. When the government turns against the people, rebellion is a responsibility.
Behind the removal of the duty of the Secretary of State is that the government can now move to both privatise the funding, introducing insurers, private charges, downsizing and closing what remains of the NHS, and privatising the NHS infrastructure completely. And that is the project of this current government, just as it was the project of the Blair government. So the Blair legacy is now being implemented in full.
The public's been misled by Mr. Cameron and the coalition government, where they said there'd be no privatisation and no top-down reorganisations. He's trying to raise some public awareness. I've done an interview with 5 Live this evening, which should hopefully be on in the morning show.
Extermination of animals. This government's attitude towards you is very little different. You may be next.
And we owe it to our ancestors not to let everything they fought for with such sacrifice be stripped away from us. We stand together. We fight together. We will win this together.
10 to 3 in the morning, so I've just done a 9-hour stint, so that's why I'm looking a bit rough.
Looking a bit peaky, you're not
Yeah,
looking too bad.
I'm not feeling too good.
Thank you
yeah,
very much.
But thank you.
Cheers.
Cheers.
I had no idea you were doing
You just ran 42 miles!
The end game for the government is the American healthcare system. This is no laughing matter because the denial of care, where you get people, women with cancer, diagnosed with their breast cancer, who must decide, will we bankrupt my family or will I die? That's the stark choice they have. Government is taking us back to the Dark Ages, to the Dickensian times. And that is what we're returning to, and we're doing nothing about it. So what we've got now is an increasing clamour and noise from people who are concerned. So we're using social media, we're using Twitter, we're having campaigns, but it will never be enough until these campaigns and activities mobilise and engage with the democratic processes, which at the moment all we've got is the ballot box. But until that happens, it will never be enough. We can shake the politicians for a bit with a noisy campaign, but it simply isn't enough.
For what I think is important, what's important for me is the acknowledgement that power isn't there, power is here, power is within us.
So campaigns are fantastic, they're very important for putting information out there, but it doesn't stop. When people have the information, they're empowered to articulate the argument, but it needs to go much, much further into political and democratic engagement.
The NHS bill, drawn up by barrister Peter Roderick and Professor Alison Pollock, was presented to Parliament by Green Party MP Caroline Lucas. The product of 2 years' work between academics and campaigners, the bill promises to stop and reverse 25 years of privatisation. It will end wasteful market bureaucracy and save billions every year, moving away from free market fundamentalism, which dominates our politics. It will reassert the sovereignty of a parliament and protect the NHS from international trade treaties, which promote the right of corporations to exploit public services for profit.
I think we're going to find a generation of young people who are going to turn around to the older people and say, what the hell have you been doing? How could you land us in this shit that we're living in?
They owe consideration to the generation that comes after them. They owe the consideration to their children and grandchildren.
We are being poisoned against one another for the benefit of a tiny minority at the top who are feeding on us. We have to change that. Talking about fighting for the NHS for future generations. My son said, I'm going to find the guy selling the NHS and kick him in the Goonies. Let's start kicking people in the Goonies.
It's time to act. Visit Our NHS, the National Health Action Party. Another angry voice. Keep ournhspublic.com and join campaigns where services are being threatened in your area. Visit the NHS Bill website. Refuse to support those politicians who voted for the privatisation and support only those who commit to backing the NHS reinstatement bill.
Irrespective of how you vote, irrespective of your politics, make sure the man you vote for is on your side. If you don't take your stance now, and you will have lost your National Health Service.
We don't trust the politicians of any party. We wrote this legislation so that politicians would have no wriggle room. So if you go onto our website, www.nhsbill2015.org. It took a fight. It took 2 world wars, millions of people to die to get our NHS and the welfare state in the first place. We can't let it just become a memory. We can't let that flame flicker and then go out.